Hello, friend. Welcome, friends,
Hello?
once again. Yes, madam. I'm just introducing you.
नहीं
Please
नहीं
wait.
नहीं सर, आपकी आवाज थोड़ी कट रही है.
Oh, I think that is some disturbance which is coming. Am I clear now?
Okay. Yeah.
Yeah. Hello, friends. Welcome once again to our webinar series. And today we have got Dr. Ritu Garg, who is going to take a session on deriving teaching learning methods from competencies. Right. Competencies, we are working on deriving objectives, and to achieve that objectives, we need to use appropriate teaching learning method. So some important teaching learning method, which is important for competency based medical education, we are going to just have an introduction. And for that, I request Dr. Ritu Garg, Professor, Department of Microbiology, MMI, MSR. Madam, your city?
Mulana. Yeah, Mulana.
Okay.
Mulana.
And city, that is New Delhi.
Mulana, sir. Mulana. Haryana mein. Yeah.
Haryana. Okay. So welcome, madam. Session is over to you.
Thank you, sir. Good evening, everyone. I am Dr. Ritu Garg, presenting here Deriving Teaching Learning Methods from Competencies. Before I start my lecture, I want to say thank you to Dr. Sanjay Vedi for giving me this opportunity, and I want to say thank you to Dr. Sanjay Mehta for introducing me and also helping me while preparation of my presentation. The learning objectives of my presentation is, at the end of the session, each participant should be able to enumerate various teaching learning methods used for large and small group teaching correctly, and discuss the advantages and limitations of commonly used teaching learning methods. Then identify the appropriate teaching learning methods as per domains of learning and level of competency. I want to ask, what is the purpose of teaching? The purpose of teaching is to facilitate learning and to make sure the learner is learning effectively. Whereas learning is a process when there is a change in or modification in the thinking of the learner. The next question comes, what to teach? It is very difficult, we all know, to teach everything in medical science, and very difficult for the learner to learn everything in medical science. So it is very necessary to categorize the subject which was earlier categorized into the must know, need to know, and good to know. But nowadays it is categorized into the core and non-core competencies. The next question is how to teach. Very, very difficult question to answer. The answer only is the teaching should be interesting and effective. It is in the hands of the teacher how to teach, which teaching learning methods we can use according to the resources, according to the requirement of the need of the students. Now coming to the types of teaching learning methods. I have here, this is group size based, large group, small group as individual teaching learning methods. In 2 or 3 slides, I am just enumerating the different teaching learning methods, and in the subsequent slide, I will give a bit detail of these all. Like large group teaching learning method, one very commonly used is lecture, which is didactic and interactive lecture, and most commonly used in the undergraduate teaching. The next two are symposium and panel teaching, which are also large group teaching learning methods, but we less use in the undergraduate teaching. Then coming to the small group teaching learning methods, there are small group discussions, tutorials, case-based learning, demonstrations, practicals, bedside teaching, field work, and role play. Talking about individual teaching learning method, they are guided reading, like some teacher is assigned some reading material to the student. It is just promoting the self-directed learning. Then next is project or individual task or assignment. That is in now CBM scenario, these are electives, and earlier we there is STS project with the student. Student came to us and we give them and help them to do this task. This all promotes self-directed learning. Third is counseling. What is counseling? When the student finds academic difficulty, then that they came to the teacher and teacher find the solution and help them out. Third, next is simulations. Simulations are the teaching which gives the students a real scenarios like situation, and this type of teaching is used like to teach them the CPR like in on the mannequins. It is not much used in microbiology, but is very useful in the other subjects. Now coming to the understanding of the CBM curriculum table, I will not talk much about this table because we had several times discussed about this table. In this table, there is the topics are given. Each topic is assigned certain competencies, and there is domains of learning, level of competence, core and non-core. Then we have to derive the objective from this competency, and then in today's lecture we will learn how to derive the teaching learning methods from these objectives which are aligned to them. We all know these competency, learning objectives, learning methods, and assessment method, they go hand in hand. We drive the learning objectives from the competency, and then we drive the learning methods which are aligned to this objective. Then these assessment methods should also align these learning methods. So these all go hand in hand. Now have a look what CBME have for microbiology. There are 8 topics which have core competencies 54. For that, we are assigned 70 hours for lectures, 110 hours for small group teaching, which can be taught as tutorials, seminar. We can use and there is a we will use the integrated learning also, and 10 hours specifically for the self-directed learning. So total 190 hours for the microbiology. Coming to the one by one teaching learning method, first is lecture, which is a very commonly used teaching method for undergraduate teaching, and it is a traditional and convenient method. I have the other 3 points on in red. There is a purpose why they are in red. They are less. If it is told about the lectures, they are less effective. One-way activity. They are long because every lecture is of 45 to 60 minutes. Why these are in red color? I have kept in red color because these 3 points. There is certain methods by which we can make this weakness of the lecture we can convert into the strength of the lecture. What is that? I will discuss after a while. The lecture can be made effective by when we plan carefully. What do we mean by plan carefully? When we plan our lecture, we should define our learning objectives and we should deliver it confidently. The third point is I will discuss a little better by showing you the one case scenario, and I will ask you what is the reason of this problem in this scenario and how the person can improve it. Now I am reading out this case scenario. Mr. X MBBS, he is a gold medalist in MBBS. He also completed his post graduation with gold medalist. Now he has joined as assistant professor in medical college where he was assigned classes of undergraduate students. He was very enthusiastic for his first lecture. He prepared the lecture from various resources like reference books and internet. Then he delivered the lecture with his best effort with 95% attendance in the class. But on the subsequent lectures, he observed that attendance was decreasing. He was very disappointed. Look, in this scenario, the person is well versed with the knowledge. He was enthusiastic. and he prepared the lecture well ahead. But in spite of all the things, there is a decrease in the attendance. Now I want to say, Dr. Sanjay Bedi sir, please ask the participant what could be the reason, how they can improve it. Sanjay Bedi sir, please. Hello. Hello. Bedi sir, can you hear me?
Yes. Yes.
Please, sir. Please, sir,
Uh,
unmute the participant.
Yes. Please raise your hands. Please raise your hands or write in the chat box. Yes, in chat, Yashbin Roy says he was more uh, theoretical.
What is the missing part here? Yes, he is right.
Sai Leela is saying restrict the topic relevant to audience and make it more interesting.
Okay, why? How did?
Dr. Sai Leela, please unmute yourself.
Yes, sir. Whom we are teaching is more important.
Okay.
The audience are important, and the audience should be able to grasp what he is teaching. It's not the quantity of the topic. Whom we are teaching is very, very important. It should be relevant to them, and we have to restrict the topic to them.
Okay, sir. Okay. Anything else?
Dr. Rajani Sham Sundar.
Too much information, ma'am. Not focused for the target audience.
Okay.
Also
Anything
not
else?
interactive. Also not
Yes.
interactive.
Yes, very good point. Yes.
Dr. Nagaraj.
Can you hear me, sir? Yeah. See, class consists of different types of students. Some of them are prepared and they have come. Some of them are not in a position to understand what the teacher is talking. See, the target audience will have different levels of learning. So we have to address to the poorest of the poor in the class to understand and make him come up and learn. On the other hand, he should not disinterest the person who already knows something about the subject. So he has to address to both the ends of the thing, and that moderation comes by experience, and just giving over information, over enthusiasticness, it will actually hide that point of it, and that makes the student getting bored.
Okay, sir. How we can cut this boredom?
You have to give the basic information.
Okay.
Then you also have to give one or two additional points for those who are intelligent enough to pick it up.
Okay. Okay.
And here your experience counts a lot. Your own experience, when you discuss with the students, you are taken as their person to follow. That's why you become their mentor. Otherwise, you don't become a mentor. You are only a teacher.
Okay, sir. Sir, any
Hello?
other answer?
Yes,
Hello?
Doctor.
Hello.
Yes, please speak.
Yes, sir. I'm Dr. Jaya. I think that decrease in the attendee because of it was not interesting. The lecture was not interesting. Moreover, it was like more of theoretical things. So I believe it would be, if we use more clinically correlated, it would be nice. It would be better for the students to understand and to visualize something, to imagine something, and it will be more it will be rememberful more. That's it.
Yeah, hello.
Hello?
Yeah, Dr. Mukesh here, ma'am.
Yes,
Ma'am,
okay.
yeah, it also depends, ma'am, the what type of lecture we are taking. It means that if it is audio visual, point one, ma'am, so that is important, and how much we are involving the audience means if you
Yes.
involve more of the students,
Hmm.
in that they will be more attentive, and they will, and what ma'am told, that if it is relevant to their subject, it means we are correlating, because all the second year MBBS and the first year they their thought will be that to become a good clinicians. Once we correlate our subjects with the clinically, how it is more relevant when they come to the practice, then it will be
Yeah,
generate more interest in that. So
Yes,
audio
right.
visual, the more
Hmm.
interaction with them, one
Yes,
to one,
yes.
less
Hmm.
time, not 60 minutes and all. No, ma'am. Minimum 35 minutes with good interaction and a small topic and quick, then attendance will be more interesting, ma'am.
Yes, yes. Good, Dr. Mukesh.
Thank you, ma'am.
Yeah, Sanjay sir, go ahead. Can I go ahead?
There are some comments on the
Okay,
chat box also.
okay,
Students
sir.
should, Raghavinder Rao is saying students should be made more interactive. Rachna
Yes,
Patel is saying explain should start from their level. Just uh, Jashbeen Roy can be improved by more interaction. That's it.
yes. Okay. All the participants have identified the problem very well. Yes, there is a lot of lack of interactivity. Although the teacher has good enthusiasm, good well versed with knowledge, but there is not at all interactivity. So, why interaction required in the lecture? We all know the attention span of the student or the person is 15 to 20 minutes or 10 to 15 minutes. So interaction, what interaction do with the this boredom? It cuts the boredom, enhance the student attention, it promotes deep learning, there is better understanding with interaction, and retention also increase. There is a better recall of knowledge and application of the knowledge. So we should make our lecture as interactive as well. We know if we have a good understanding of the topic, we can apply it well. This is a common saying, I see what mind knows. How we can make our lecture interactive? So, how we can make our lecture interactive? Encouraging students to interact, and we should also interact with the student by asking questions. Get student to ask the question. We can brainstorm in between the lectures. We can use the watch groups in between the lecture. We can plan some mini quizzes like multiple choice questions in between the lecture. And one is think, pair, share, and activity, which is commonly we can do very easily. We can do in the lecture. So the impact of interactivity is what? It become more effective. It will become two-way communication now. Now it will break the monotony also. These 3 points which I have written in red, now they become the strength of the lecture. Coming to the small group teaching methods, first is very commonly used small group discussions. What is there in the small group discussions? One teacher interact with 8 to 10 students, and in small group discussion there should be clearly defined learning objectives, and one student will act as a group leader. The role of the teacher is facilitator, and he should ensure that in the subsequent group discussions each student should get an opportunity to become the group leader, and the teacher should ensure that every student should participate in this. And the example I am giving here where we can use, this is only the one example, there is plenty of topics where we can use small group discussion. Like we can discuss opportunistic infection in HIV as a small group discussion. Next is tutorials. It is also like a small group discussion. One teacher interact with 8 to 10 students. We commonly used in day-to-day practice in microbiology. It is a teacher-centered activity. The difference from small group discussion, where that is student-centered activity, it is teacher-centered activity. It helps students to clear the doubts, and these are designed to find out the extent of understanding, because tutorials are always planned after the series of the lectures. One example I am giving here where we can plan the tutorials like importance of rapid diagnostic tests in diagnosis of malaria, and we used to held the tutorials for lab diagnosis for the applied microbiology like lab diagnosis of malaria. Next is DOC, that is demonstrate, observe, assist, and perform. That is what is that this is small group teaching learning method, very important. What happened here, the teacher demonstrate the steps of the activity which is which is for the particular topic. Students observe what the teacher is doing, then they will assist with the tutor. At the last, the student will perform first in the simulated environment, then they can perform independently. Where we can use dogs in microbiology for the steps of staining techniques like gram staining, Zn staining, for microscopy of the stool, for peripheral blood smear, which are used in the microbiology. We can use a dog as a teaching learning method. The other teaching learning method we can use as a bedside clinic. Here the students are watching the case of meningitis. And one of the other small group teaching learning method is field work, which is commonly used in the community medicine. The photo is showing the student is giving polio drops. And next is the role play, which is used to enhance or to teach the communication skills. The next small group teaching learning method is case-based learning. This is based on the real life scenarios, and in this we can bringing the patient to the classroom. We can bring the patient in the form of the paper case, or we can bring the patient in the classroom, in the real patient in the classroom. What the students do here? Student interpret the findings, they makes the diagnosis, and orders are required tests and plan for the treatment. And student apply what knows into the actual practice of managing the patient. So what is the example? The example is like we can use the, if we are teaching the student a Salmonella typhi, we can show them as a paper case, typhoid case, as a typhoid case scenario during the lecture, beginning of the lecture, and we can show them real case of the typhoid as a bedside clinic. Next is the problem-based learning. It is a complex method of teaching learning. It is what happened here. Instructor present the problem to the student. Instructor helps student to identify what they need to learn. Student identify the problem themselves. They make a conceptual hypothesis. Then they identify and list the learning issues. And here the student themselves make the learning objective. They are not early. They are not pre-designed. Then student list potential source of information. They organize who will do what. Then all the group is evaluated. Group performance is evaluated, and evaluation of the individual group is also is there. In this, by this problem-based learning, this is very good method for the critical thinking of the students. Next, now the next mode of learning, that is not the not belongs to small group teaching. That is why I have added this slide, because which is relevant to this scenario, e-learning. It is a system of learning in which content is delivered electronically. It is of two types: asynchronous, that is self-paced. What we do here, we upload, teacher upload the teaching content on the portal, e-learning portal. Student can access that content anytime which is there, which is feasible to them. Then there is a synchronous learning. We create the virtual classroom like we are doing in the Zoom and in the Microsoft Teams. It is a teacher centered. Synchronous learning is teacher centered. Or blended learning, it is a mixed mode of learning, synchronous and asynchronous. Now here let's apply this, how we can drive the teaching learning method from the objectives based upon the domains of learning and level of competency. I have taken some of the competencies from the competency table, and I have tried my level best to cover all the domains of learning and level of competency. So the first competency I have taken from that is 3.1. But what is that? From the third topic, gastrointestinal system, that is enumerate the microbial agents causing diarrhea and dysentery, describe the epidemiology, morphology, pathogenesis, clinical feature, and diagnostic modalities of these agents. See here, domains of learning is K. that is knowledge, and level of competence is knows how. So our learning objective should be in this domain and level of competency. So we can cover a number of objectives in the one teaching learning methods, like define diarrhea, define dysentery, enumerate the most common bacterial agent causing diarrhea in infants correctly, enumerate the most common bacterial agent causing dysentery correctly, explain the epidemiology of diarrhea in India, and explain the pathogenic mechanism of common enteric pathogen correctly, list the appropriate specimen collected for laboratory diagnosis of diarrhea. All these learning objectives are falling in the domains of learning knowledge, and we can club here, and competency knows we can cover here in one teaching, that is interactive lecture. This explain what the pathogenic mechanism of common enteric pathogen, we can also we teach them in the small group teaching, because this can fall under the knows how level of competency. Now next is elicit the clinic feature of diarrhea. We can show them the paper case in the lecture and describe the diagnostic modalities used for diarrheal agent. We can hold the small group discussion and tutorial. So in this way we can cover our level of competency up to knows how. Now next competency I have taken 3.2. Here the word is identify. Identify the common etiological agents of diarrhea and dysentery. Domain is S, that is skill. Level of competency is shows how. When the competency is upper competency is given, the lower competency levels are already achieved. It means the student is already known about knows and knows how. Now we are reached up to the shows how. Now what we will do here, identify the common etiological agents of diarrhea, identify the common etiological agent of dysentery, which can be done in the small group discussion and practical session. Here the student will be taught about the what are the different modalities to identify, like how we do the microscopy, what are the culture media we will use, how to interpret the colony characteristic, that is shows how. And we can do they can prepare the saline wet mount of the stool provider correctly by drops, demonstrate, observe, assist, and performance. Then they can identify the pus cell, RBC, cyst. I mean to say they can interpret the wet mount findings in the saline in the stool correctly. That is up to the shows how. So that is up to the shows how level of competency. The third competency I have taken 3.4, that is identify the different modalities for the diagnosis of enteric fever. Choose the appropriate test related to duration of the illness. See here domains of learning is S, skill, but the level of competency is up to knows how. So how the skill, it means the skill will be intellectual skill. There is three levels: intellectual skill, manipulative skill, and communication skill. So what intellectual skill means, if he has the background knowledge of the enteric fever or Salmonella typhi, when it can be detected in the blood, when the antibodies will appear in the detectable level, then only he can choose the appropriate test related to the duration of the illness. So in this we will do enumerate three diagnostic modality for diagnosis of enteric fever to cover the knowledge level. Then we will another objective will be choose the appropriate test related to duration of the illness, that can be covered under the paper case in the lecture, or we can show the bedside case, real case on the bedside clinic. We can I can show you one of the scenario which I have prepared for you people. A 10-year-old boy was admitted to the pediatric ward with a history of remnant fever, which increased gradually in a step ladder pattern over previous 8 days. See here, 8 days fever. He had taken antipyretics and ciprofloxacin prescribed by the local private practitioner. See here, no antibiotic susceptibility has been done. This is prescribed without that. And then there is no change in the situation of the patient. He then goes to the tertiary care hospital. He complained of lack of appetite, pain in the abdomen, and lethargy. On examination, he was found to have fever with anemia and hepatomegaly. a blood sample was obtained for culture and serology. His blood culture was positive for Salmonella typhi and Vidal test was negative. His isolate was resistant to ciprofloxacin and he was put on ceftriaxone. He responded after 10 days of therapy. In this case scenario, what we can discuss with the student, although it is a 8-day fever, so Vidal test is negative. Why? Because the antibiotic level is not on the detectable level, and the patient was on ciprofloxacin. He was not improving because ciprofloxacin was prescribed without susceptibility testing. So he will know the importance of susceptibility testing in this about this case scenario. So that is why this will come under the student will show the knows how level of competency. Third, identifying positive agent of enteric fever correctly from the blood sample. In this objective, we will only focus on the description. What are the tests he can use, not the he will not do anything. He will only how the microscopy will be done, demonstration, the steps. No, he will not do anything because the level of competency is knows how. Next is I have taken the 8.14 competency, demonstrate confidentiality pertaining to the patient identity into laboratory result. Here domain is A, that is intellectual skill, the affective domain. Level of competency shows how. This type of affective domains on communication skills can be better taught by the role play. How here we can frame one of the objective will be communicate positive HIV report to the patient confidentially. How we will maintain the we can teach in the role play how he can maintain the confidentiality of the patient. Next competency I have taken 8.7, that is very much relevant to today's scenario. Demonstrate infection control practices and use of PP. Here see domain as skill, level of competency P, means this will be manipulative skill. What are the learning objective I have framed for this? Enumerate component of standard precaution, which can be taught by interactive lecture. Define PPE, which can be taught by interactive lecture. List components PPE, which can be taught by interactive lecture. Then discuss the rational use of PP. He will know this rational of use of PP if he knowing each and every background about the PP. That can be done in small group discussion, that is knows how. Now demonstrate steps donning and doffing of PP correctly under supervision. That can be taught by dog, and this is shows how. Now next is perform donning of PP while entering in the simulated COVID ward. That is again perform done by can be taught by dog. So in this we can teach the student up to P, knows how, shows how, and perform, and we can complete the domains of learning is skill. So this is all about, I have covered all the domains of learning, level of competency. Thank you. These are the all teaching learning methods. We can apply it according to the domains of learning and level of competency. Sanjay sir, thank you.
Thank you. Any questions? Please raise your hand. Dr. Ranjani Sham Sundar. Please unmute yourself.
Thank you, sir. Ma'am, two doubts I had. One
Yeah,
is
okay,
what
ma'am.
is the difference between the way small group discussion happens and PBL? Like, what is the source of the information? I know about PBL, but I'm a little confused between the difference. And second question, I don't know about think, pair, share. If you can explain that also.
Okay, ma'am, very well. Ma'am, what is the difference in small group discussion? Here, in small group discussion, learning objectives are already defined.
Okay.
We know the problem, but in
Okay.
case of problem-based learning, we give the scenario to the student. They identify the problem where they have to learn. Then they make their learning objective themselves.
Okay, ma'am. But what
Yes,
is the
ma'am.
source of the information for the students in that small group discussion? Like in PBL, we tell them to research, they can check online, they can check textbooks, talk to.
Yes, ma'am.
But here, what will they do? Like,
Ma'am,
like
suppose I am taking, okay ma'am. Ma'am, suppose I have shown you the scenario na enteric fever.
yes, ma'am.
I will show. अगर मैं I have not taken any lecture on enteric fever. Suppose
Okay.
Suppose
Okay.
I have given this scenario to the student. Go there, read about enteric fever, and come to me how you will choose the appropriate test for this scenario, and what is the importance of why the ciprofloxacin was resistant, what was the problem. They will read their resources and they will come with the resources and they will make the learning objective themselves. बट जो
Okay.
मैंने अभी आपको बना के दिखाए.
Okay.
ओके एंड व्हाट इज
What?
हाँ
Yes.
हाँ जी मैम आस्क मैम.
Same thing, ma'am. Think, pair, share. I don't know what it means.
Yeah ma'am, I am using very frequently in my lecture. What I do after 10 minutes or 15 minutes, but I have taught in the 3 or 4 slides, I ask the student what is that. Suppose I am choosing, I am teaching the enteric fever. Suppose, so I will ask the student what are the etiological agents of enteric fever. So I will told you, please make pairs with your next one. And I am giving them 30 seconds or 1 minute. Then I will ask, but share with each other. You have written the suppose think matlab you think what are the etiological agent of enteric fever and write on the paper. Then after 30 seconds, I told them share with your companion. They will share. Then I told them share with me. Think, pair, share activities. That's ma'am.
Okay. Thank you so much.
Yes. Okay, ma'am.
Ma'am, recall what were you saying?
Yes.
Recall.
Okay.
What
You're
ma'am?
testing recall. Yes, ma'am. Okay. Thank you,
Ma'am,
ma'am.
what?
Thank you.
Okay.
Dr. Preena Balla.
Good evening. Very
Good
nice
evening,
talk.
ma'am.
Dr.
Thank
Ritu,
you, ma'am.
you've given a very nice talk. I
Thank
missed
you,
out
ma'am.
beginning portion. Did you cover self-directed learning?
Yes, ma'am. Self-directed learning, ma'am. Actually, I have told you this is that can be done when we give the problems to the student to find out the solution themselves. Like we are giving them in this CBME, we are giving the elective. Choose your topic, what you want to do the project, and we will guide them. They will do themselves at every moment. We will guide them whenever they find the difficult. Like we are doing STS projects, ma'am. They choose a topic, we help them out to choose the topic, then we told them do this, do that, this is the source of information, go to the library, go search for the internet. They search themselves, they come to us, then we help them what is relevant, what is not relevant. That is self-directed learning, ma'am.
Then how do we choose the topics for self-directed learning? What we have done in our institute, we prepared our SLOs totally, DOAPs, everything.
Yes,
But
ma'am.
we have chosen those topics which we could not cover in all the competencies. We have, for example, certain small topics, and we'll say we'll give it to 5 students, and they will present the certain components of that. Is that the way to go about it?
Ma'am, you can go about it. You can go about it. Any topic which you can find key, it is we have to. They should be actually suppose in today's scenario. I am talking about the rational use of PP.
Yes.
I want the student learn rational use of PP. We told them everything about PP. What is PP, donning, doffing, how to reuse, how to use it. So then we give them the question. Just discuss what is the rational use of PP. They will search internet. They will read the ministry guideline. Then they will come to us. This is rational. Then we will discuss in the small group. We can discuss in the small group. Now tell me what is the rational use of PP? That is self-directed learning, ma'am.
Okay.
Thank you very much. Dr. Ritu, may I add something to that?
Yeah, why not, ma'am, sir?
Madam, Dr. Preena.
Yes,
See,
sir.
when we decide about the self-directed learning, we'll have to be very sure that these are the topics which are important for microbiology, but they are not very well covered in our routine teaching learning methodology, right? As for example, if you talk about immunoprophylaxis, That is one of the very good example, because we don't take that much in our either lecture or practical, rather than showing them few vaccines only.
Okay.
So if you give them as a self-directed learning, one condition is that there are objectives which we need to decide, right? That student should be able to at least enumerate various national program of immunization. Then they should be
Okay.
able to identify the advantage, disadvantage, route of inoculation and complication and everything, right? So that objective you give them, how they are going to achieve that objective, you give them guidance, that you go to this website of Ministry of this, you go to this book, you go to that book, and
Okay.
then when it's complete, you can have an assessment, because this has to be completed by each and every student. It is not only one group of students who will be preparing and presenting seminar and rest will be listening. It is not like that. All will have
Okay.
to go through that, and at last you go either for a written assignment or some questionnaire or something like by this, which you can say that they have achieved that particular objective. So this is SDL that we routinely do not take it in our curriculum, but they are very important for our subject.
Thank you. That was really clear. That cleared up a lot of my doubts. Thank you very much.
Yes,
Welcome,
in fact, formative assessment is very important for this, and you have to give specific time for SDL, not just sitting. I mean, tell them to read them themselves. You give them some time also, and
But
there's
then,
the Kahoot app which we have created a club. We find it. We'll be starting from tomorrow some hands-on discussions on Kahoot. That is a very good tool for. I mean, it gives a contest. The faster fingers first. There's a
Okay.
good interaction.
Okay.
So
Thank you.
yes, Dr. Ritu.
and ma'am, I want to say something to Preena ma'am.
Yes, please.
Ma'am, I am finding very honored to talk to you, because I have heard very high about you from my friend. I know you very well, but I got the opportunity to talk to you today
Thank
only.
you so much. Thank you. I'm probably the oldest person in this whole group.
No, ma'am. Not like that, ma'am. My friend was your student, sir, ma'am.
Okay. Thank you so
Madam,
much.
Okay,
you are
ma'am.
the youngest participant.
Oh,
And
so we have youngest and oldest.
one more thing is about SDL is that please avoid dedicating special hours during the teaching learning. Otherwise, it is wasted, because they need to go out and learn, right? If you give 2 hours in a class, then they are wasting that 2 hours. At the end, you can call them for 1 hour and look for the assignment, but
Yes.
don't teach them the topic. That is the thing.
Okay. Right.
So anybody else? Doctor. How to continue large group teaching after this lockdown? Dr. Sai Leela. Yes, Dr. Sai Leela. Please unmute yourself.
Yes, sir. I want to know from various faculty members what they are going to do. These lectures, how to continue. Hello?
Hello?
Am I audible? Am I
Yeah,
audible?
you are audible, ma'am. Yes, ma'am, you are audible. Sanjay Bedi sir,
Capacity
can you answer?
Some form of online learning is now going to stay. There is no
Yeah.
doubt about that. अब सबको
Yes, sir.
सबको ना यो क्या कहते हैं, खून लग गया सबके दांत में और सबको पता चल गया कि ये भी कुछ होता है, तो अब तो ये रहेगी. और some kind of though it may be in the class, it may be in the hostels, it may be in students staying at their homes, and even after the lockdown ends, some kind of social distancing is also going to stay.
Okay.
And lot of online tools people have found it, and they know that now this can be done and this can be used very efficiently.
Yeah.
So
May I add? Yes, sir.
yes, please.
Would like to answer your question very specifically. First of all, this lockdown has created online teaching learning, right? And everybody is
Yes.
into it now. As an
Yes.
example, in our department, we have completed syllabus of bacteriology and parasitology both by online teaching learning. Either it can be
Yes.
asynchronous or synchronous. Some of the Zoom lectures, and we have created many videos. The problem with this is that whether students are learning or not, we are not sure about. So, each and every lecture which is being created in a YouTube, we are also assigning them a formative assessment. So, lecture followed by formative assessment, lecture followed by formative assessment is the thing which you can do. And I think that will be right.
Can I tell you what we are doing in our online teaching? At every end of every PowerPoint, we have 3 or 4 questions which the students are supposed to answer and send back their answers to us within 72 hours. And we don't assess them. We are marking them present on the basis of sending their answers. We will do an assessment after the end of a system. That's but attendance marking is a very important component. If these are going to be taken as classes taken, and how do we mark their attendance? So we devised this method that we give them 2 or 3 questions in the last slide. They are supposed to send the answer to the teacher who has taken that class.
Yes, that is very well. It's a good method, basically.
Yes.
Problem
Yes.
problem would be regarding the marking of attendance, right? We can
Yes.
definitely say that these are the topics which are covered. But once again, that will be a difficult aspect, right? That will be a difficult aspect. But definitely, it will be the topics will be covered. That you can definitely conclude.
That is how we've been doing for the last 2 months. We
Yes,
are
yes.
getting
Because
feedback. Students are submitting their answers and we are marking them present.
yes. That is very well. Based on that, we cannot define their eligibility to appear in examination. That is a problem. Attendance in that way cannot be defined. Yeah.
Okay.
So, Dr. Nidhi Singh,
Hello.
Hello.
Good evening, everybody. I am Dr. Nidhi Singla. I am Associate Professor at GMCA Chandigarh. I just had a recent experience of taking 2 online classes for my students, MBBS students. I like to make a point here that at least in my experience, it's not really easy to teach through the screen. You are not having a direct interaction with the students, so it becomes difficult for the teacher for taking the session. I think we will have to highly improve our PowerPoint presentations, make them more clinical, and it's more like keeping this element of surprise for ourselves too, so that we are engrossed while taking the classes, as well as keep the students engrossed.
Yes, you are very right. But there are hello.
Yes, sir.
Yes.
Yeah, there are tools available which you can incorporate, and then you can also make your lecture interactive even on online. Definitely, what you are doing is very good, but it can still be improved with the use of certain technology and certain softwares. That is what Dr. Bedi sir is saying about Kaut and other things. There are Google apps also which can be incorporated, and this can be made more interactive.
More interactive. Okay. Thank you, sir.
Dr. Nidhi, I want to add something here. Actually, I also thought the same point. We cannot make the lecture interactive. But I have some example. Like both my teachers, one is from engineering branch. They are taking lecture on Zoom or MS Team, and they are teaching them maths on the online, and they making it so interactive. I have seen them because they are so much tech savvy. We can make it, but it will actually we also have to learn about more technology.
Hey, you are
Okay?
absolutely right. When
Yeah.
you are using, you are absolutely right.
Yeah.
When you are using
Yeah.
Zoom, then you are
Huh.
obviously looking at a person and it can be interactive. It can be in a small
Yeah.
group teaching. But for a
Yeah.
large group teaching, when you're teaching 100, 150, 200 students, then it is, I think it's really not easy to look at
It's
everybody.
not easy. Yeah,
Sometimes
it's not.
students don't even unmute themselves. So it becomes a problem.
Yeah, so it is difficulty is definitely there, but by the time we will also used to it. It is a change for ourselves also, na? And change is all. Yeah, yeah,
Obviously, at least for
yes,
this batch, it's going to stay like this only.
yeah. Anything more?
Dr. Nagaraj has Dr. Nagaraj, can you unmute yourself? Yes. Sir, yes, you have asked a question. Can you just?
Yeah, we do this interactive sessions with the students with last topics. We will not be able to cover within the specified time, and they are very important from point of view of clinical as well as their learning for the examination point of view also. Such topics, we divide the whole class into different groups. They select their own leaders and a sub leader, and we ask them give the task. Say 10-15 days are given, and they prepare their material, the entire topic. We have done the skeletal part of the last topic, and then the skeleton is the muscles are filled into that by actually they prepare their either a poster or they make a presentation of the entire thing, and the entire class gets the interactive session. We are totally completed, and the topic is totally covered by that way. And we also invite the clinical departments and other allied departments for such interactions in our college.
It is a very good example.
Yeah, very good.
So,
thank you, sir.
Any comments? Anybody else? Dr. Sanjay, yes, Dr. Deepa, Dr. Sanjay, you have circulated your own link to the group, and I can see 5 Sanjay Mehtas on the panel.
Oh my.
Okay. Yes, Dr. Deepa Thirat.
Sir,
Yes.
hello, I'm Dr. Deepa from Bangalore.
Okay.
Sir was talking about some Google apps to make the sessions more interactive. Can you enumerate some, sir?
One very good is Google Forms. Then there is Socrates. Then there is Kahoot. Then there is a Soapbox. Hot potatoes.
Yes.
Yes, sir. Google Forms we have been using, as the ma'am has already mentioned, getting attendance and feedback and all that.
Yes.
Will there be any sessions on Soapbox and other apps, sir?
Yes, we had conducted one group, one session, and we have already started one Kahoot users club.
So, yes, sir. Kahoot.
Yes, I think that will start most likely by tomorrow.
Okay.
And now at present registration is going on, and that is slowly and steadily, because we need to practice that. Because just attending one 1 hour lecture and out of which 30 minutes is given to something else, without practice it is difficult.
Yes, sir.
But once you do the practice, I saw in my son's class, it's like a gamification. Faster finger first.
Fingers first.
So
Yes.
just like Kaun Banega Crorepati. So I see that children are very enthusiastic about this game.
Okay. Thank you, sir.
Yes. So I'm not seeing, but that's all I think. So we can end it here.
Thank you, sir.
Yes, yes. It was a wonderful session and discussion. And we'll start our presentation with SLOs of general microbiology, right? Group number 1, next session.
Thank you, Sanjay. Thank you, Sanjay
Yes.
Bedi sir. Thank you, Sanjay Mehta sir. All the participants, thank you very much.
Okay, bye. See you again.
Bye. Bye.